Originally there was no drug treatment for HIV, and over the years advances have been made and now there is much optimism. The drugs have many side effects, although these have been reduced due to the pill burden being reduced. Adherence to the regime is vital to ensure that resistance doesn't happen. This means taking them at the same time every day with no missed doses. Although some regimes are more forgiving than others. This diagram is quite complex, so don't worry about trying to understand it all. The point is that if an HIV patient regularly misses doses of their medication, resistance will develop because of the ability of HIV to mutate, as discussed earlier. This is serious, because resistance limits treatment options, increasing the likelihood that HIV will do damage to the immune system. In addition to allowing us to treat HIV, antiretroviral drugs give us a range of options for preventing infection in the first place. One of these is post-exposure prophylaxis or PEP. PEP entails the administration of HIV medication to a person who has had a potential exposure to HIV. They must be given the first dose of these drugs within 72 hours, and may have to take them for up to 3 months. In over 90% of cases, such a course of action is able to prevent HIV infection. An exciting development in using HIV medications to prevent infection is pre-exposure prophylaxis or PrEP. This is the reverse of PEP in that H4 medications are administered before a potential exposure rather than after. Typically, PrEP would only be used by persons engaging in high-risk behavior. For example, unprotected sex with a high number of partners. We will discuss PrEP in a bit more detail later.